Hello, I'm Dr. Richard Gould, Acting Medical Officer of Health for York Region. Vaccination uptake continues to increase in York Region, with almost 88% of the 12-plus population having received their first dose of a COVID-19 vaccine, and almost 85% having received their second dose. This is great news for the entire community. Thank you to everyone who has taken the time to be vaccinated, and I encourage those born in 2009 or earlier to get vaccinated as soon as possible if they haven't already done so. In York Region, we have many age groups that are close to or have already reached over 90% vaccination coverage with 2 doses, such as the 40 to 44 age group and 75 plus age group. However, our vaccination coverage rates remain lowest among residents aged 25 to 29. Just under 79% of residents in this age group have had at least 1 dose, and almost 75% have had 2 doses. We'd really like to see more uptake in this age group, and I strongly recommend all residents in their 20s to get vaccinated as soon as possible. You cannot rely on your age to protect you. We have seen young adults fall seriously ill from the virus, even with no underlying health conditions. The incidence rate, severe symptoms, and severe outcomes continue to be higher among unvaccinated individuals. Over the past 2 months, unvaccinated individuals have been 12 times more likely to acquire COVID-19 than those fully vaccinated in York Region. Getting vaccinated also helps protect those around you, including children under 11, who are not eligible to get vaccinated at this time. This remains our best protection against COVID-19 and our best strategy to end the pandemic. Vaccinations have played a key role in getting us to where we are now. Thanks to vaccines and all residents doing their part to protect themselves and those around them, we continue to see the number of COVID-19 cases continuing to decline. A decrease or stable trend in weekly incidents continues to be observed across York Region's municipalities and most Ontario public health units. Vaccination is also accessible and convenient in York Region. For a list of vaccine clinics, visit york.ca/COVID-19 vaccine. With more provincial restrictions lifted, such as capacity limits and settings where proof of vaccination is required, it is important to remember COVID-19 remains active within our communities. Unfortunately, this leads to positive cases being identified in a variety of settings. Although vaccination is very effective, there is still a chance you could contract and spread COVID-19 after being immunized. The cooler temperatures will have us spending more time indoors, and many of us are looking forward to seeing family and friends as we head into the holiday season. Everyone should continue to be mindful of symptoms they may be feeling. If you're experiencing symptoms of COVID-19, even mild, seek assessment and testing at a COVID-19 assessment center as soon as possible and stay home otherwise. We are also noticing a concerning trend where individuals are not going for testing right away when they develop symptoms. It is important to get tested right away, even if you are fully vaccinated. We do not want to lose the progress we have made and can't assume it is not COVID-19. We all have a role to play, which includes following current public health measures and getting vaccinated. With flu season approaching, many people may be wondering if the COVID-19 vaccines will help fight against the common flu. It is important to know COVID-19 vaccines are only designed to prevent infection and severity from COVID-19 disease and are very effective at doing so. Unfortunately, any COVID-19 vaccine does not provide protection against other diseases. We recommend everyone maintain a full immunization schedule to protect against vaccine-preventable diseases, including receiving an annual flu shot. The flu shot is strongly recommended for everyone 6 months of age and older and is free of charge for anyone who lives, works, or goes to school in Ontario. Getting the flu shot is your best protection against getting and spreading the flu. It can help reduce illness for you and your family and helps limit the strain to our healthcare system, which will be impacted by co-circulation of flu and COVID-19 again this season. If you haven't received a COVID-19 vaccine yet, the National Advisory Committee on Immunization recommends COVID-19 vaccines may be given at the same time or any time before or after as other vaccines. You can get your flu shot at the same time as your COVID-19 vaccine. If you recently received a COVID-19 vaccine, you do not need to wait to receive your flu shot or any other type of vaccine. If you are pregnant, breastfeeding, or planning to get pregnant, getting the COVID-19 vaccine is safe, effective, and highly recommended. The COVID-19 vaccine does not contain any live virus, any mercury, aluminum, formaldehyde, or any substances harmful to you and/or baby, and it also does not contain any human and/or animal blood or byproducts. Several studies have shown the antibodies you make to fight COVID-19 following vaccination also pass to your baby, which may keep them safe after birth. The National Advisory Committee on Immunization, or NACI, has released guidance on a booster dose of COVID-19 in Canada and where it is recommended. We look forward to receiving guidelines and eligibility requirements from the Ontario government this week. Visit york.ca/COVID-19 vaccine for information on what to do if you are vaccinated with 1 or 2 doses outside of Ontario or Canada. Thank you for your ongoing support throughout the COVID-19 pandemic to help protect the health of all York Region workers, residents, and our communities. Stay safe, stay informed, stay vigilant, and please get vaccinated.